You're recognized.
Thank you, Mr. Chairman. Mr. Commissioner, last week in our district work period, I spent most of my time visiting with senior groups. And in the conversation, usually in the question and answer section afterwards, in every instance, I had a senior that raised their hand that said they knew someone or some family that they were confident was receiving disability benefits, that they felt like that person was defrauding the Social Security system. The other question that came up was almost every one of them asked the question, is the rise, in response to that question, I would use your statistic that we've had here, that there are 600,000 to 700,000 new claimants, more than there were, what was it, 10 years ago?
3 years ago.
3 years ago. And that response brought on the question, then is the Social Security Trust Fund solvency threatened by the 600 to 700,000 more claimants? And the general attitude is that there's a fear among people that have worked their entire life that this segment, the disability segment itself, is threatening the entire integrity of the fund. Can you address that for me?
Sure. There's a mythology in a lot of quarters, and the media feeds this from time to time, that the system is rife with fraud, and that's just simply not true. Is there fraud? Well, sure. With a system this big and with standards this complicated, is there some small level of fraud? Yes. I think the level of fraud is much smaller than in most government programs. I think it's some fraction of 1%, and we do everything that we can to try to root those out. But I think what you have to be aware of is that increasingly, particularly as our societies and Congress's definition of disability has expanded, there are people who are legitimately disabled who don't look that way to their neighbors, and their neighbors make unfair conclusions. And you see this with people with a variety of mental conditions. You see this very typically, for instance, with people with early Alzheimer's. We even had a despicable case with one of our own medical examiners who saw someone with early Alzheimer's and just ridiculed the person. I apologized in a public hearing, for the way one of our own people reacted, because we don't get it, we don't understand. So I think people are sometimes very quick to assume fraud when in fact what they're seeing is a non-apparent disability.
What about the issue of these claims threatening the solvency of the Social Security Fund?
My view is the level of fraud is so low that it's a rounding error in terms of the solvency of the system.
Okay, setting fraud aside, what about the increased number of cases with the 0.90 payroll deduction? Are there statistics out there that say that the 0.90 raises this much money and this much money is coming out of the system based on that?
No, that's a good question. Something that should give you confidence in the integrity of the system is, as with the recession-related claims, which economists and others would say are, typically would not meet our standards. If the system has integrity, then the allowance rates should drop. And our allowance rates have dropped during the recession, both at the DDSs and even more dramatically at the hearings and appeals level, because we are seeing more claims that are not meritorious. The increase in claims is not a result of any significant change that we've made or that you've made. 80 to 90% of the change probably, and we'll supply more information to you about the record, is entirely predictable, has been predictable for decades. It's what the Office of the Actuary has been telling the Congress would happen, because people basically of my profile, aging baby boomers, are in their disability-prone years. And so the amount of disability allowances we are seeing are relatively close to what the agency, CBO, and other experts have been predicting for a long time.
Thank you, Mr. Chairman. I have a couple of process questions. We've talked a lot today about baby boomers and they're entering the system as disabled. Once a person reaches the threshold of age 62 and they have the ability to go on early retirement, what's the process that a person would go through once they've reached that threshold, and then but they don't want to take early retirement, but then they apply for Social Security disability? And then they're denied initially, and then they're given a waiting period that might take them past the time whereby they would enter the system at age 65 in full retirement. So how are the hearings determinators? I mean, how are you handling people that are entering the office with those kind of problems? And I'm not sure who to direct that question to, but perhaps somebody that has some everyday experience.
Actually, I'm just going to speak up to say that I'm probably not the person that we really need to know from Social Security, because that kind of decision happens in the field office. So I don't know if probably the closest person to Social Security is OIG here. Do you know the answer exactly? I do know that you can have a sort of a simultaneous early retirement and disability going at the same time, but I can't tell you exactly how that works. Obviously, we wouldn't double dip, but that kind of thing does occur. But I would hesitate
so that
to
if a
answer
person
the question
was
more.
62 years old and they applied for total disability, and the total disability benefit was $1,000 or $1,100 a month, and they were able to receive early Social Security benefits, they can't receive Social Security benefits and be permanently and receive permanent disability. You can? No, you can't.
No.
So this whole
I
perception
wasn't clear.
of the system being weighted down and broken because of all of the baby boomers that are entering the system because they're retiring and become, more and more of them are becoming disabled, there seems to be a point at which that would flatten out, because they would either go into early retirement or they would go into permanent retirement. And you wouldn't be receiving both at the same time, would you?
No, you would not receive both at the same time. I misspoke in that way.
Ms. Masters.
I can speak to that a little bit. They would not receive both at the same time, but of course the early retirement benefit is an actuarially reduced benefit, and the disability benefit is not. So they would receive a higher benefit if they are awarded disability benefits, and then at their full retirement age they just convert into the regular retirement program, but maintaining that higher benefit level.
Are any of these things taken into consideration when the initial claim is made? So that it would be a very small cost for a person to have a combination of a partial disability benefit and a early retirement benefit. And why would someone be asked to wait 1, 2, or 3? Why would somebody wait 1, 2, or 3 years and appeal their claim if they're going to reach the threshold of retirement anyway? Yes, ma'am.
Thank you, Congressman. A person, as Dr. Masters said, if I am 62 and I go in and apply for retirement benefits, I'm going to receive a reduced benefit, and that will happen for as long as I receive benefits. So as an individual, I'm entitled to get disability benefits until I reach my full retirement age, which I would point out is now 66 for people who are retiring now, and will go up to 67. So that it is a big disadvantage to me in terms of my income if I apply for retirement at that point. In the SSA evaluation, there is for disability, there is a piece that takes age into account in the vocational guidelines. So that is considered from that perspective when someone comes in and applies. But it is up to the individual to decide whether they want to apply for early retirement or disability. And if it is an individual who has a disability, it is in their best interest to apply for disability because their benefit will be at the higher level as opposed to reduce for the remainder of their life.
Okay, thank you. Thank you, Mr. Chairman.
You bet.